what are targeted therapies? I know you've talked again about them a little bit, but would you be able to elaborate on sort of how they work and how genomic testing helps that further?
Yeah, absolutely. So there, there's been an evolution of systemic cancer therapy. So we use very often what we call a chemo or cytotoxic chemotherapy, which are agents aiming to destroy cancer or rapidly dividing cells that these drugs are interfering with the cell division. So when the cell is divided into two, these medications intersperse between the DNA spindle and basically messes up the whole process of the cell division, and the cells die. Sometimes it also affects fast-growing cells, such as the hair cells or the bone marrow cells. So that's why you see anemia and decreased blood counts in patients who receive chemo, and also you see hair loss in those patients. Eventually, all these are transient, right? It goes away when you stop the chemotherapy, but that's a reason for you to realize how these medications work. And there's so many of them. We use them in combination, and each one of them has a different point in the cell division or the cell cycle where they act against. So that's what we combine them in many cases. There's targeted therapies now, which are basically small molecules that are a refined product of understanding the biology of the cancer. So they are aimed to interfere with specific cell pathways that are necessary for growth of the cancer and spread that by blocking genes or proteins. So, for example, a very clear example of this is as straightforward as breast cancer having endocrine markers. We're doing targeted therapy for those patients because we're not giving typically chemo initially. If the cancer is driven by estrogen or progesterone, we use anti-estrogen drugs or endocrine therapy, and that is targeted drug, right? We're targeting only the pathway that the cancer is thriving upon. But we have learned even further in learning how to block, cell signaling pathways that are altered by the mutations. So as we were mentioning, those mutations, for example, an EGFR mutation in cancer or an FGFR fusion in breast or NTRK fusion in other tumor types, what they do is that they basically get the cell into autopilot to grow, like basically giving all the time fuel to the fire. There's no control. So the cells grow, exponentially, and they don't stop. If you know what is the specific key to that keyhole that turns off the cell from growing and kind of normalizes the process, because that's the only thing that is acting up, then you make successful targeted therapy. So that's the rationale for this. Typically, those pills are taken by mouth. For many of them, there's small molecules that finish in NIB, like sorafenib, trametinib. Everything that is IB, like it means, inhibitory molecule, basically. So all those drugs are aimed to do that. The sort of targeted drugs, which are also immunotherapy combination kind of a thing. So they're monoclonal antibodies that are targeting against the specific biomarker in the surface, like trastuzumab for breast cancer is an example of that expresses HER2, basically goes against the surface and kills that cancer in that area. Immunotherapy is the other modality. It's the most newer of the treatment options that we have, but it's been in studies for many years. It's basically aimed to boost the body's natural defenses to fight and destroy cancer cells. So typically cancer cells are smart, right? So they say, don't kill me, I'm legitimate, I live here, I'm part of you, but actually they're not good. They're a spy trying to kill everything, but they're smart about it. They don't want to be killed, so they express molecules on the surface, or they stop the immune system to acting, basically calling the police, don't kill me, go elsewhere. And the idea here is to awaken the immune system or train the immune system so we can recognize those cancer cells as foreign or as malignant, and then eradicate them as normally will happen. So those are all the kinds of treatment options that we can do. And now there's a combination of them, all based on biomarkers, mechanism of action. So the field is very rich right now in combinations.